Yeah, so the main impetus was to try to think about ways of helping the community. I've always been feeling like giving back to the community, especially those in need. And vulnerable populations are obviously mostly affected by COVID. All of us are affected by COVID, but they're disproportionately affected. And so in my work with the free clinics and other work that I've done in the community, I've always felt like giving back in that way. And then at the same time, I felt like there were so many students wanting to help too, and they were sort of stuck. They couldn't even really take classes because they're all remote. They were frustrated with that, and they wanted to help with respect to COVID, and they couldn't. There was just, I saw volunteer, students wanting to volunteer, and they couldn't do that. And I thought this was a great way to make both of those things happen. One, I guess in the beginning, there was, so many different messages being sent, both publicly, and misconceptions about the disease and the lack of mask wearing, even experts saying, oh, masks don't help. And, trying to really figure out what is the right message for the students to give when they're going to teach the class. The other was the challenge, we wanted to actually start it last year, and it was hard to get it going. And then I got it going for the summer. And then a lot of the students really didn't want to take summer classes because they would have to pay tuition. And I'm like, oh God, now we're at that barrier, So there always seemed to be some sort of barrier. And then the fall hit. And of course, as we expected, the numbers went up. And fortunately, we got the class going, and a lot of students signed up. And I was just so happy about that. And, some students even, audited the course, and from, undergrad to grad students to medical students to, our what we call our chipper students, the community health and prevention students. And so we just got a whole array of students and a really good outpouring of those that wanted to help. So a little different this quarter, but I guess the big picture is they do a sort of a intensive sort of how to do contact tracing through an online platform. We used the Hopkins platform last quarter. We used the UCLA platform. They do that for the first week. They actually have to get some training through the county on how to use the program to document their calls. They have to get a background check. It's just part of the policy of the county. So there's some logistical issues and sort of getting up to speed with contact tracing just in the first week. And my role really in the class is to teach them communication skills. With what I do, I'm a general medicine doctor. I do a lot of video visits. I do a lot of telephone visits. And so what I'm trying to teach them is some communication skills that they can use when they're doing their calls. And these are skills related to like how to set the agenda, how to express empathy over the phone, how to counsel, how do you effectively counsel someone? And so those are kind of the things that we do in the class. We had guest speakers come and talk about how to use interpreters because that's an issue. So it's really interesting a lot about how I take care of my own patients on a day-to-day basis through my telephone visits or video visits that they actually have to learn. So I use a lot of what I do day-to-day to teach them. Yeah, it is. It's a little more challenging. I teach this in the medical school, and we've learned how to do it a little better, I think, but it's not ideal. For example, just trying to teach empathy, a lot of that has to do with, nonverbal communication skills, right? And how do you do that over the phone, right? It's all verbal. Sometimes you can talk about intonation and pauses and things like that, and how to address emotion just hypothetically. But, it's not the same when you're in person to try to address someone's emotion, right? So yeah, definitely challenging. And obviously there's a lot of emotions involved with COVID. And sometimes it frustrates the students, and rightfully so. Yeah, and in fact, just this last class, I decided, because I noticed the students a little bit of frustration with, they're learning these skills and they're counseling these patients, and then they get the situation where they feel like they can't help them. Like they can't provide them with the resources they need because the client they call they can't isolate. They're in a 1-bedroom apartment. They're with other people that, don't have COVID, that are vulnerable. How do they help someone like that when the person they're calling is in such a difficult situation socially? and it frustrates them. They get what we call empathy fatigue, because they're so empathic and wanting to help them, but they can't. And so we talked about that in the last class on how to sort of make sure they take care of themselves as well, because I think that's really important. We see that in our healthcare providers who, as you probably know, many healthcare providers end up burning out because they get frustrated and not being able to help the person that they're really, trying to help. So that was an important, I think, class for us to have. I guess I have been so impressed on how well they picked this up. I mean, Stanford students have been just fantastic. What I do in the course is I listen in on conversations of their contact tracing in the course. And I remember last quarter listening in the first calls, and I'm going, oh, wow. It's their first call. So you're like, okay, they're learning. It's their first call, and they've had the boot camp, and they've had, but they're nervous and they're fumbling through the script and they're forgetting to ask certain really important questions. And I go, okay, we give them some feedback and so on. I'll listen on your call, next week or the week after, and then the next one is just fantastic. They just picked up on the feedback. They've thought about their script. They thought of how to personalize the script. And you realize the first call was just really nerves. It's just really, the first time they're doing something like this, it's a little scary, right? And it's just amazing how quickly they pick it up. And I listen to students now that have done it for, couple of weeks, and they are just so good. I mean, they could be, some of the medical students that I have in my clinic working with me, doing phone calls to my patients. They are so good. So they really have embraced this, and I can tell they're working on their own to just improve their skills. So I've been very impressed, I should say. Yeah. Will there be other pandemics? We're still not over this one, of course. So I'm maybe thinking too far ahead, but there probably will be other pandemics. And I think my ultimate goal would be that the course would not be needed. It sounds kind of crazy, but I don't think we want this disease around, or any other disease like this. This has been such an impact. So ironically, my goal is, I guess, we won't need the course. Well, I actually think it's definitely the wave of the future. It's the wave now. We've been forced by COVID, and if there's any silver lining, COVID's pushed us to do this more. Mm-hmm. There's so much benefit to telemedicine. Now, it doesn't completely replace my, in face-to-face visits, but it really is convenient, right? It's convenient for the patient. It's convenient for the doctor. You can have more frequent touch points easily, and you can actually do quite a bit. We have remote ways of monitoring patients now. I have patients that can hook up their blood pressure machine, their glucometer, and all that, and transmit that to me virtually, and I can have a very nice televisit. They can be in the comfort of their own home. I've had patients even in bed doing a televisit with me, and it's nice. They don't even have to get out of bed. It's pretty cool. So I think it's a lot to be said about using this more. I will say, I think one thing we really need to do is get the technology in the hands of the patients that need it, the vulnerable population. I mean, the vast majority of the patients that we do our calls with really can only do calls. And it would be nice if we could get them some technology where we could actually do video visits, because you can get more by actually seeing them. They can show you, rashes or physical exam findings that you could then, probably save them a visit on. And technology is pretty cheap now for them to do, get a small tablet that they could use with a camera, right? If there was ways that we could incorporate that into our practice, providing them with that technology could really enhance our ability to care for them. It's been tough, I tell you. I was really motivated and always feel optimistic that, things are going to change. And, you had glimpses of the vaccine coming out, in the fall, and finally we got it. And then now we're seeing variants. And so I have to admit, it's wearing on me too. I've been vaccinated myself, but then I'm seeing, are the variants going to be able to get around the vaccine, or, you still worry that you still can spread the disease even though you've been vaccinated. So it's definitely worn on me. And I just feel the plight of the people too that haven't been vaccinated and also are just stressed by this, especially the young people. Well, everybody. I see the young people, needing to have that social contact. And, I've talked to my med students, and they I go, well, let's have a Zoom get together. And they're like, enough Zoom. Can we be in person? And I just, it breaks my heart to have that. And I'm just really, really hoping we can start to have more in-person contact safely. No. I just want to applaud the students, the ones that have spent the extra time and effort to do this, and really helping the community that really needs this. It's really grateful for their motivation to do that. It really shows a caring community.